Hey, Confessions of a Midwife.
That's me.
Are you ready for 21 questions or more?
I am.
Let's go. So, Yunesu,
Yeah,
it's nearly midnight.
it is.
What hours do you work?
I work all hours. I'm a midwife. But tonight I'm on a night shift on triage.
Triage.
Yeah.
So, can you give me a tour of triage?
Come through. I'll show you here first, yeah? So this is our reception area, like where you just came through. So our ladies come in and they take a seat there. As you can see, that's a play area, but at the moment, because of COVID, they don't come in with their children. So they didn't use that. So our receptionists, our clerks, they sit here. They triage our clients if it's during the day shift. Some are for screening, some are for fetal medicine. Those are day clinics, that's 9 to 5, so it's closed at the moment. So anyone who comes through these doors after 18 weeks, they're coming for us.
Okay.
Okay, so maternity assessment.
Maternity Assessment Unit.
We use this room as a single triage room if we have any infectious or possibly infectious clients. So that's where they'll be in isolation until we've made a decision on where they're going.
Okay.
Everything on the right hand side is fetal medicine and screening.
Screening. Okay.
So come on this side first, I'll show you. Our drug room, as it says on the door, preparation for everything. Our stock room, that's where we put all our stuff in. Our sluice room and our stationary cupboard. Although everybody in this hospital seems to come to use this stationary cupboard. Okay, so this is our day unit.
So this is where women come in when they're...
So this is our assessment day unit. So women come here during the day, 9 to 5, if they've got scheduled appointments. So if they need to come for scheduled CTGs, if they're coming for BP profiles, if they're coming for vitamin injections, anything that's scheduled for them to do, they come over here. It's our 4-bedded bay, okay? We normally have 2 midwives here during the day. During the night, as you can see, it's deserted, it's closed.
Okay. Now, at this time of the hour, you have lots of admissions. Does it get very busy during the night?
So surprisingly, there's no busiest time in triage. It's busy during the day, it's busiest during night. So it's whatever it is that they're coming in with. So as you know, they come anytime after 18 weeks. So if it's during the night and they come with reduced fetal movements, they have to come here, isn't it?
Okay.
If they're shromed or they're not sure what's going on with their
So
baby.
if they come in with reduced fetal movement, what is it that you do?
Okay, so anyone who comes in with reduced fetal movements, if they're anything above 28 weeks, we'd put them on a monitor. We use a system called Dawes Redmond, which I think many other hospitals are using now.
Can we have a look at that?
You come through. I think we've got an empty bed. Yeah, we've got one empty bed. You can come
So
through
this is the bay for
This is
triage.
the bay. This is our triaging bay. Okay. So they would come onto a trolley. We've got 4 of these in here. And we'd put them on the monitor. We'd use the system called Dawes Redmond. And then it ticks after a while. So that criteria sort of guides us to say these are normal parameters for this gestation. This is what we expect, and we're happy with this. If the woman is then feeling movement, I don't have it on here. We normally have a probe that we put on here that the woman can click on to say I'm feeling the movements, and they're happy. Yeah. If it's a first attendance of reduced fetal movements, lady's happy with the movements, we're happy on the monitor, she can go home. If it's a second attendance or recurrent, then we'd have to take it up. The doctor will have to review, or if there's other contraindicating factors like
That's a date of birth.
GDM
Okay.
or hypertension or other things like that, we'd have to have maybe a scan, we'd have to have a doctor to have input there before we send them home.
Now, one of the common problems that women do come in with contractions, so irregular contractions, or they're coming in with waters are broken. What exactly do you do then?
So if someone comes in with query shrom and they're low risk, their baby is moving, if they think the color of the water is clear and they're not worried about anything else and they've had a low risk pregnancy, we'd ask birthing center to triage them because they are for birthing center. If, however, maybe if the waters have broken and the color is not what we want, then we'd see them here. So we'd speculum them, we'd confirm that the water is broken. We used what we call ROM+. So it's like sort of a pregnancy test. So 2 lines means positive, 1 line means negative. Unless, of course, it's a sure history and we can see it, yeah?
And if the waters are broken, how do you confirm that the waters are broken? Is there any kind of procedure you do to confirm that the waters are broken?
Yeah, so we use a speculum.
Can we have a look?
Yeah, do you want to come through?
Yeah.
I can show you everything through here. So so in each of our bays, we've got a trolley that houses everything that we need. So it should really ideally be stocked up, so we're not going in and out while we're seeing a lady.
So fully stocked, yeah?
So should be fully stocked. So this is our speculum. This is what we'd use, and we'd use the test that I've explained to you. It's called a ROM plus. So once you've speculum the lady, or in the process of speculuming the lady.
So this is a speculum.
Yeah, this is the speculum. We'd use a test called ROM plus. So we'd swab the lady.
Okay.
And then we'd use that swab to determine whether the waters are broken or not. Like I said, you'd get the line, the one line if it's negative, the two
Now,
lines if it's positive.
if the waters are broken, what's the next step that you take?
So if everything is normal, okay, everything, all things being equal, we do offer immediate induction. Yeah,
Okay.
we offer it to the lady. She can say yes, she can say no, and if it's okay for her to say no, she can come back after 24 hours, in which time we expect or we'd hope that contractions might start or she might go into labor. If that doesn't happen after 24 hours, then she'd come in for an induction of labor.
Okay.
If obviously she's got meconium or there's something wrong with the CTG,
so
fetal
just want to stop you
tachycardia.
there. What's meconium? So meconium is
So meconium is when baby passes stool.
the baby does the
Yes,
poo inside.
yes,
Okay.
So if that's happened, then there's always a risk of aspiration. So we need to be continuously monitoring the baby to make sure that everything's okay.
Okay. So if the waters are broken, there's no contraction, she's had up to, you said 24 hours?
She can have, yeah.
Okay. Now, what if client comes in with contracting? What happens then? What do you
Okay.
do? How do you assess?
So, so if a lady comes in contracting, we would offer her, depending on gestation, of course, the midwife can see from 37 weeks going upwards. We'd offer her vaginal examination. To
So
check.
what exactly is a vaginal examination?
So it's an internal examination where we would check the cervix, the dilatation or the condition of the cervix to see.
And what do you use? Use two
We
fingers?
use 2 fingers. Leader, yes, we use 2 fingers. So that would determine whether labor starting. Is it active labor? That's from 4 centimeters. So sometimes just to be careful with the choice of words we use, because we say, oh, you're not in labor, but the woman's experiencing so much pain. So sometimes it's very important to then say, no, you are in early labor, but not quite effective at the moment for
Okay.
you to be dilated.
So if the client is less than 4 centimeters, she's not in established labor,
in
what do you do then?
So we offer analgesia. It's good for her to go back home actually and be in her own environment. She can mobilize, have a warm bath. She can just relax, just be as normal as possible, really.
The client must be really disheartened when they find out after all these pain, they're like only 2 centimeters. Now, how do you support them through that stage, encourage them that they're...
So like I'm saying, like mostly the choice of words we use, and just to make them understand. So once you've explained something to someone and they understand what you're saying, it's easier for them to accept it. To say, oh, so you mean I need to get to this stage? Oh, you mean I can do this to get to this stage? What else can I do? So just explaining to them that actually, it started now. Be happy. It started, especially as a first-time mom. It might take longer, and then just carry on that way.
Brilliant. Now, if the client is 4 centimeters, what happens then if they are in established labor? What's your role then?
If they're in established labor, depending on what their birthplace choice is, where they've opted to give birth, depending on what analgesia they want to use. If they want to use epidural, then it means that they'd have to go on the labor ward. Even if they're low risk, if that's what they want, that's where they'd go. If they're low risk and they want to use the water and they want to go to birthing center, then they can go there. So at that point, we'd just be hoping there's capacity for them to go there. But it's good for them while they're waiting, even here, to mobilize analgesia and just, to take things as easy as possible, really.
Now, if they're contracting, they're in a lot of pain, how do you manage to move them up to the birth center or delivery suite?
If she's able to mobilize through the lift, then that's good.
So have you got like a hidden lift that...
Yeah, we do. We have our own secret lift. So we take them through there.
So this is the secret corridor
this is
to
our
get to
corridor.
the...
This is our internal corridor. So because of COVID right now, partners can't come with us here. They go through the external lift. So they meet us upstairs. So we'd come through here. So this takes us to the large ward, antenatal and postnatal. That takes us to admissions ward, and this is the lift we'd use. It takes us straight into labor ward or birthing center.
Okay, so this is a special lift that goes straight upstairs to the birth center or delivery suite.
That's it.
Now, how do you get through these night shifts? What, do you like down all the caffeine or?
No, actually.
No?
I mean, your body gets into a system, isn't it?
Yeah.
You're used to what you have to do. We're just opposite of the day workers. You sleep when they work, they're awake, and they sleep when we sleep.
So do you only work nights?
No.
You do mix?
We're not allowed to only work nights. We do a mix.
Mix.
Yeah.
Okay, but you're still looking very glamorous, even during
We
the
try.
night shift. You got to welcome the ladies, right? You can't be looking
Even
at
if
them.
it's 2 a.m., isn't it?
If you could make a change in the triage department, what would it be?
I'd want women to come into triage confident that they're going to get the best care that we can give them. I just want them to know that they're coming to the best place they can come to at that time. And I just always hope that my colleagues and myself, our attitudes, our faces, our conduct just gives off this aura that they can come, they can recommend Newham, because we do try.
But that's great. So everyone, midwives are lovely and welcoming, so don't be afraid to attend triage. So what are some of the main reasons why women come in for urgent reasons? So it's normally reduced fetal movement.
Reduced fetal movement, blurry vision, headaches. We give women information about if they start getting sort of like edema, itching, if they start itching in their palms, in the soles of their feet. These are all symptoms of conditions that could become serious in pregnancy.
And they need to come in.
They need to come in as soon as possible.
Now, a lot of women get put off coming to triage because they're like, oh, it's such a long wait.
It's important for women to understand that triage is like an A&E for maternity. So sometimes they may have to wait, especially if it's a case of where they need to be seen by the doctors. So sometimes, because our doctors service other areas as well. So it's important that women understand this before they come. We do see women as quickly as possible. We've got a RAG rating where we try to see specific conditions within specific times, and we try to meet that most of the time. So it's not always a first come, first serve basis. It's the priority of what you've come in with that might mean that will make you see us.
Now, can you just reassure clients that they shouldn't wait to see their midwife at antenatal appointments? If they need to come in, they should just come in straight to maternity assessment unit.
Oh yes. I mean, there's a list of reasons why you should just come in. Yeah. Don't wait. Don't wait for 2 hours. Don't wait for 4 hours. Don't wait for 6 hours if your baby hasn't been moving. You'd rather come in and then we tell you that everything's okay after we've assessed you. Or don't wait if you're getting this banging headache and you're getting this blurry vision because you know you've got an appointment with your midwife tomorrow. You need to come in. We need to see you. We need to tell you that everything's okay. Then you can go home. And you've heard about the itching. You've heard about it. And I'm sure, there's Dr. Google there. So there's a lot of confusion and confusing information there. Come in, let us tell you. We're the experts. We'll let you know what's happening with you. If it's fine, we'll just send you home. If it's not, then we'll do what we need to do with you then. So please come in if you need to.
So what do you love about
You're
midwifery?
not a nuisance.
What do you love about midwifery? You're not a nuisance, ladies. Babe?
Oh, what do I love about midwifery? I love making the difference. I know that I make a difference each day when I see the women I see, just empowering them with information, allowing them to make choices based on information that is, has been reviewed, that is trusted, and that is not just old wives' tales. There's a lot of that going around. So I love midwifery because it gives me an opportunity to just witness this new journey into life with the parents, and the children.
And your last question. What have you had for dinner today? Have you had dinner today?
I did actually. I had a stir fry.
Stir fry, is that going to run you all the way until your shift end? What time did the shift end today?
8 o'clock.
So you started at 7:30.
7.
And your stir fry is going to run you all the way until 8
I'll
a.m.
have coffee at some point.
Great. Thank you very much. It's been an honor And
you.
we hope we see you on our channel again. Be sure to subscribe.
See you then.
Bye.